Secretary, last year I asked you this question, and unfortunately we're in the same boat. Article 8, Section 12C of the Pennsylvania Constitution requires a financial plan for not less than the next succeeding 5 fiscal years, which plan shall include for each fiscal year, 1, a projected operating expenses classified by the department or agency by program in reasonable detail, and estimated revenues by major categories from existing and additional resources, and 2, projected expenditures for capital projects, specifically itemized by purpose and the proposed sources of each. Now, last session, you level funded out years after the upcoming one that we're doing the budget for. We're facing a $3.2 billion deficit, and you've done it again this year. Last year, several of the departments tried to pass this off on the Secretary of the Budget. And my question to you is, did you prepare the budget and your department? And if so, why we don't have the next 5 years projections?
Sure, I do recall that question from last year. Thank you. You know, we account in our budget. First of all, we work very closely with the Governor's Budget Office in developing our budgets. And we project statutory mandates. We include in that
But the constitutional mandate's what I'm getting at.
Existing collective bargaining agreements. We include all of that. And some things are level set, but we also try across the board to continue to do cost savings and reduce
But you've
costs.
got a 9.7% increase to your budget this year that you did not project last year, let alone for these other outgoing years. And when we're facing a $3.2 billion deficit, we've got a responsibility to ensure that we know what kind of expenditures are coming up. And that's the reason that was put into the Constitution in 1968, is because people were hiding things. And my question to you is, this is a constitutional mandate. Why is it not in there?
Again, we work with the Governor's Budget Office on our projections, and if you have specific questions on that, I would refer you back to...
That's the specific question. Where all these line items, are you saying that you're not going to spend any more on that next year?
Well, we continue to look for cost savings in our budget. We are, for instance, we are working right now on space utilization. We anticipate saving about $500,000 next year in our quality assurance.
But looking at those savings, were you not looking for those last year, and you still ended up with a almost 10% increase?
Well, some of that is for new initiatives, as we just discussed, $15 million for rural health and behavioral health.
You know what, I'm going to go to the rural health situation.
Sure.
I've got the most rural district in Pennsylvania. UPMC is shutting down labor and delivery in Cole, up in Coudersport.
Yes.
I now have 5 of 7 contiguous counties, an area larger, and I'm talking about 7 that do not have labor and delivery after April 1st. There's a lot of ink spilled on Black maternal health. There's a lot of ink spilled on maternal health in general. But the most rural part of this state is getting excluded from any help in this area. And I want to know why.
Well, I would argue that I have, and the administration has been working on rural health. You know, I have been trying to go out to the rural hospitals. I've visited many of them. I have more visits planned to try to understand what we can do. Again, the Department of Health is a regulatory agency around hospitals, and we oversee them from, again, our regulations, but we don't have the power to prevent a closure. We are working very hard to give exceptions where we can.
Madam Secretary,
but in terms of,
I've heard a lot. I mean, I understand that, look, the Rural Health Redesign Center has been fantastic. But what I have not heard from the department is anything about helping these rural maternal health labor and delivery centers, which we've got closing. I'm not hearing anything from the department on it. There's no ink being spilled out there. There's a lot of ink being spilled by the governor about Black maternal health, but there's nothing about rural maternal health.
Again, we have been talking about rural maternal health.
I haven't heard it,
Well,
and my time's up. Thank you.
sorry.